Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. I'm your host, Michael, and we are here with the guide, Josh Vance. Hey, Josh, good to have you here for this episode. Hey, doing quite well. All right, Josh, we've hit on a couple of different topics already, and we are going to dive into another one. Appreciate all of the feedback that you've given us, really from a technical, professional standpoint. Today, I'd really like to look at kind of the big topic of like what's really happening in your body. And so let's jump straight in if you're ready to go. So what about this? Like on the topic of kind of symptoms and the source, like you've talked about wanting to get down to the root issue. Why is it pain is often not coming from the place that people feel it?
Pain is a perception from our body. And when we have a perception, it's perceived in one place, but it isn't always generated from one place. That's called referred pain. Oftentimes we have pain that is at one place, but actually starts somewhere else. One example could be nerves. So the nervous system is very complicated. It's very complex. But say you have a pinched nerve in your neck, well, that can cause pain that may go down your arm. Okay, so, treating the arm without figuring out, hey, this is a problem of the nerve root in the neck, this is going to be a problem because they're not going to get better. But there are lots of places. Another example is trigger points. So the trigger points are areas within muscles that basically get stuck being contracted. And they basically have to get kind of release from that, but they will cause pain in other places other than where that trigger point is. It's called,
Wow.
So it's referred pain.
Yeah.
Pain can come from a lot of places. Obviously, it can be localized too, but it's not always localized. It can definitely come from other places. And so that can be misleading to a person when they feel, hey, I have pain down in my foot when it's actually not coming from the foot.
I can see where being a guide is really important because, again, if I have this pain going on, like you said, a referred pain, I may be treating something or self-diagnosing this is what's going on and actually not being getting to the root problem. And so I can see the need for somebody to come in and help me diagnose where that's actually coming from. So that's great. What about this? How does the body, you've hit on this to some degree, but how does the body compensate when something isn't working right?
Good question. That's an interesting question, though, because the body, when it has things to do, it's going to figure out how to get it done. Example, we need to get from point A to point B. We're going to walk there one way or another, short of not absolutely being able to walk. So when we do that, sometimes we'll do it by compensating. So that may be putting more weight on the non-injured leg than, say, we injured our right leg when we fell and it hurts. And so now I'm going to walk, but I'm not going to put as much weight on that right leg. I'm going to compensate and put weight on the other side. We still got to get to point A from point A to point B. So that's how we're going to do it. Another example could be someone that's trying to reach up in the cabinets, but they can't because they're having shoulder pain. And so what they do instead is, instead of just reaching straight up, they just kind of lean over to the side in order to get up to compensate. Again, they got to get the dishes out. So they're going to do what they have to get the job done, even though it may not be a normal.
Yeah, that's interesting. So do you think, I'm trying to think of times where I've done exactly what you're describing. I'm noticing in my memory banks, I'm almost doing this intuitively or instinctually to avoid the pain and to compensate. Do you find that to be true, or do you find that there's much more of an intentional thought process in that?
No, it's just something that we do. It's not necessarily intentional. There may be some times when it is, but more often than not, a person just does it because that's what they have to do. It's just going to happen. They aren't thinking about it. They're just doing it.
Okay. Well, what about this one to wrap up this segment? Let's say that I've got some referred pain going on. I'm treating what I think is the actual problem. What kinds of problems do I create when I'm only treating those symptoms and what I think is the right answer?
Well, obviously, kind of the biggest problem would be, hey, we don't get better. If we're treating some pain that's not generating from the actual area, then that's not going to be very effective. Other times we might get a little bit better, okay, but only partly when we're treating the symptoms. The biggest thing is really not treating the symptoms, but the cause. So figuring out the underlying cause, handling that underlying cause, then the symptoms are going to improve. So an example might be, say you have pain right here in your upper trap muscle, and it may feel better with some stretching, maybe some soft tissue work, maybe some strengthening exercises. But the reality is that's not why it's hurting. The underlying reason is because I don't have enough mobility in the ball and socket here. And so I'm compensating and shrugging my shoulder every time I'm reaching overhead. So until we deal with this other problem, that's going to persist, even though it might help temporarily. It's not going to fully get handled because that's not the ultimate problem of what's going on. We have some other underlying movement pattern problem that's going
Yeah.
on causing that issue.
Again, I just hear you in the right way echoing that whole optimal health guide thing. I want to guide you toward optimal health. I don't want you just to, fix what you think is going to, you know, deal with what you're currently facing. Let's say, Josh, that I'm past the threshold of trying to figure this out on my own. I show up to an initial meeting with you. What are you looking for during that initial evaluation, that I may not even realize you're actually looking for?
I'm looking for several different things. Some of the things might be movement patterns. I'm observing from the moment I introduce myself to someone and they stand up and walk with me. I'm wanting to see how are they moving. It could be their shoulder, how are they grasping my hand? It could be how are they walking to the room where we're going to do the evaluation. So I want to be able to see the movement of all the joints and the structures that are moving. Also, I'm going to be kind of feeling and observing muscle tone. I'm looking for symmetry and asymmetry. Maybe there's some obvious muscle atrophy going on one side versus the other. Those are some things that are going to give me a lot of information as to what I'm going to want to look at and questions that I might ask. Also, patterns of dysfunction as I'm going through the evaluation. One example may be I'm thinking there might be an injury to a nerve in the neck. And so I'm looking at specific muscles that are all innervated by that specific nerve root level, even though they may not seem to be associated. So maybe I'm looking at some hand muscles and some forearm muscles when they have pain up here, and maybe they have some weakness in their triceps in the back of the arm. So I'm trying to put all these puzzle pieces together, but observing what's going on is a big component of the initial part of the process.
I'm realizing this is really similar to, I just went to have our car serviced yesterday and just went in for the typical oil change. But the report that I got back on the other side, well, here are a variety of other systems that you want to consider. Some that they isolated and said, hey, here's an actual red flag. So I went in for one thing, but then actually came back with a much wider feedback. I can see where, hey, I've got this shoulder thing, Josh, but you're looking at the whole entire set of systems and then providing feedback again to be able to drill down to what may be that root cause. Does that sound like I'm reflecting back to you exactly what you're trying to say?
I think that's a very good analogy for that.
Great. That is clicking for me, and hopefully that's going to click for somebody else too. What about this? I know, just in our conversations, I can tell you're listening, again, both to the words that people are using, but the wider story that people are telling you too. Why is listening to someone's story important, just like the physical testing is?
I love that question. And it takes me back to when I was a student. I had a clinical instructor one time, or maybe it was a faculty member, that told me the story, the information they're telling you is going to guide you to the problem. They're going to tell you what the problem is if you listen. If you
Yeah.
don't listen, you're going to miss it. So listening is key. And so what I'm listening for is their story of what the problem is. There may be some clarifying questions to kind of draw out a little bit more information in their story, but we need to fully figure out what is the most likely cause and the issue causing this.
Mm-hmm.
And so gathering related information to kind of prove my thought or disprove what I think is going on through the questions. But hearing their story, hearing where their pain is, hearing when it started, was there a particular injury? Did it kind of gradually come on? That kind of takes us into two different possibilities. Okay.
Mm-hmm.
If there was an obvious accident, that really helps to clarify the picture this way. If there wasn't, okay, so we have a more gradual onset of a problem that is very different. Also, when they're talking about where the pain is located, if it's a very specific point, that tells me information versus a very generalized global or
Okay.
unfocused
Yeah,
area, that tells me a lot of information too. And then maybe that then is kind of referred pain or something else going on.
sure.
So, there's just a lot of information. But again, listening to their story and then just asking some clarifying questions to kind of draw out. Some people are better storytellers than others. Some people also really
Sure.
get sidetracked. So being able to guide them back onto, you know,
Yeah.
giving me the information that's pertinent to being able to help them figure out is also an important thing. But their stories, without that, you're going to do a lot of unnecessary testing.
Beautiful picture of like the compassion that you bring to the table just simply by listening. And then, you're giving us a great picture of how that compassion is, I think wonderful to experience, but also how it helps you to be able to help that person all the more. So really, really great to be able to hear that. What are some early clues that tell you where the real issue might be?
I think one early clue is kind of the onset of the symptoms. Okay. It happened from a accident or it kind of gradually came on. And also, is it a very diffuse issue? Oh, I hurt all over here, or I hurt right there. Those are some early clues that kind of help guide, okay, my thinking process and my decision making based on some of those things that they're telling me with. Um, when it began, is it something that was recent or has it been going on for 3 years? And if it's been going on for 3 years, I'm going to want to know if it's kind of been going back and forth, or did they get help or did they not get
Yeah.
help and they just lived with it? I mean, there's lots of information to be gleaned from that that can also kind of help. Maybe it's not even something that's relevant to physical therapy and they need to be seen by a doctor. Okay. So those things kind of need to come up during this question and answer time as they're giving me this information so that we can really help focus on what that real issue could be.
I love it. You're discovering clues both through the narrative that somebody says, the cause or initiating thing from the pain that they're identifying. But yeah, I can see this kind of breadcrumb trail that you're following, trying to zero in on those things. You're getting closer and closer to clarity. And so as you begin to get clarity on what may be going on and you're able to articulate that to others, why is clarity about what's happening in the body such a relief for people?
I think the biggest relief is because they have understanding. It's no longer a mystery. And when it's not a mystery, they don't have to go solve it. So we're going to help them. They're going to know, okay, here's the problem. There's a solution. Now it's not this thing that I can't figure out or sometimes thinking that it's going to be worst case scenario or some horrible disease or something like that when it may be a very simple, easy solution. But when you give them clarity as to what's happening, they'll understand it. And then they're going to be willing to work with you easier. And they'll be able to then have that understanding. The understanding brings control in their life. They're no longer out of control. They have the ability to, okay, I'm going to be able to go to that wedding now because I'm going to be able to walk. Okay. Again, they get that control back in their life.
I'm noticing that it really is like the insertion of hope because I'd imagine, again, just like what you described, I can't do this thing. And I love the way you brought it back to a wedding. There's probably a very specific thing that they're carrying in their mind and their heart and their relationships that they want to get to. And when you can help them see the possibility on the other side, that's brilliant and really help. So you've hit on this to some degree, but push this a little bit further. How does understanding their condition change how patients engage in the recovery then?
Once they have understanding, now they're going to be, I think, several components to that, but they're going to be more willing to work. Okay. They're going to understand what I need to do. Okay. They're more likely to be motivated to do it. Maybe they do want to get to that wedding and they can't walk because of ankle pain or whatever it is. You know, I understand what's going on. I understand what we need to do to get there. Now I'm ready to put in the effort, even though sometimes it's hard. I mean, exercising can be hard work, doing, ice or heat or whatever several times a day, doing things to help yourself on a regular basis amongst life and living and work and family and all that can be difficult, but they're going to be partners in order to improve their health. And so they'll make those changes that they need to when they understand their condition.
Is there anything else that shifts once someone finally knows what's actually going on?
I think a couple of things. Maybe they come in and they're a little unhappy because they hurt. I mean, most people aren't real happy when they have pain. We get grumpy,
I would be.
right?
Yeah.
So I think something that shift is their mental state and their awareness, because I think the hope, like you pointed out,
Mm-hmm.
I've got hope now. I'm not going to be stuck in this condition. They feel better. They're happier.
Mm-hmm.
They're willing to do whatever. They change their mind shift. Okay, now I can do this. I've got the hope. I want this. So I'm going to go get it now. And we're going to help them go get it. They also then can have that understanding of how to care and prevent the particular issue that they've got down in the future. And I think also, the mind shift changes just that relief.
Yeah.
It wasn't this major problem. It is something relatively minor that can be handled in, a month or 2 months or maybe even 3 months. But, I don't have to live with it. And it's no longer this big, fearful thing that they have to that's overpowering their ability to live life. Get rid of that. Now they can get back to life.
That's so great. Well, if you're looking to be able to get back to life, if you need help in understanding what's going on in your body, again, don't fall into the trap of trying to solve a problem with some referred pain that's actually not fixing the problem. Turn to Josh and the Optimal Health Guide and get some help and some hope in your life. Thanks everybody for listening in today.